Hello everyone, I'm Chen from Sungkyunkwan University, Department of Media and Communication. I'm here today to talk to you about the research of me and my supervisor, Professor Seoul, about the effect of parental depression on children's smartphone addiction, mediating roles of children's depression and anxiety. My presentation is divided into 5 parts. I want to begin with background, and then I'll move on to theoretical premise, and then the method. And next, we're talking about the results and discussion. And finally, we'll land on limitations and future studies. Smartphone addiction has been a concerned problem in the world, not only among adults, but also showed more serious outcomes among our children because of their insufficient ability to control impulsivity. Previous studies have proved associations between addictive use of smartphones among children and negative outcomes. So to prevent such negative outcomes caused by children's addictive use of smartphones, it is necessary to identify the factors affecting children's smartphone addiction and come up with a solution to solve the problem of smartphone addiction based on them. And parents play an important role in predicting children's media addiction, parent-child conflict, parenting style, parent-child communication, and parental violence were proved to be associated with internet and smartphone addiction among children. Parental mental health is a core factor. Previous research have verified that parental psychological distress increases the risk of children and adolescents developing negative emotional and behavioral responses. And also, depressed parents tend to be less supportive of their children and have fewer positive interaction with them. Also, many previous research determined the reason of people's overuse of smartphones. Smartphones allow people to keep in contact with friends and family, engage in social interactions, and enjoy entertainment and leisure functions. For these children with psychological struggles such as low self-esteem, anxiety, emotional stresses, and attachment avoidance, they are more likely to spend a lot of time on their smartphones and on their internet to relieve their real-life difficulties. Based on these previous studies, it is likely that parental mental health may be associated either directly or indirectly with children's media addiction. It is important to explore the mechanism by which parental depression influences it. So in our study, we investigate the relationship between parental depression and smartphone addiction among children, and we also examine the role of mediational factors that could be explained the relationship. Let's move on to the theoretical premise. Some studies have indicated that parental depression can have serious consequences for children's development. Children of depressed parents are at increased risk of range of social, emotional, and behavioral problems and of carrying out disruptive and aggressive behaviors. And there are always some interactions problem between them. Particularly, parents with depression have been found to exhibit maladaptive communication patterns. Depressed parents appear more negative during communication with their children. Also, they tend to be involved in coercive interactions when interacting with their children. And children of depressed parents experience stress in response to interactions with them. And when parents and their children are in a low quality of interaction, children will seek support and compensate for unsatisfactory interaction by using media and internet. Smartphones help people in social interaction, maintain social relationships, and enhance friendships. Such social activities promote excessive use. Some studies have addressed the impact of parental depression on children's excessive use of media. With these findings, parental depression may be regarded as one of the underlying causes of excessive and dependent use of smartphones. So we hypothesize that parental depression will be positively related to children's smartphone addiction. Also, depression can be also transmitted from parents to their children. Depressed parents usually have low energy, lack of concentration, so they are less likely to meet their children's needs for support and guidance. And with chronic stress, they often miss their children's cues and fails to respond with feedback appropriately. Their children cannot get enough support from their parents. Such negative parenting behaviors have predicted increases in repressed symptoms among children because children are likely to negatively evaluating themselves, which finally increases their possibility to be depressed. Children feel anxiety always because of their emotional dysregulation. They have poor ability to regulate their emotions. When children receive care, warmth, and support from their family members, they are better able to control their emotions. However, in negative family environments, children might be difficult to develop the ability to regulate their emotions. Given these findings, it is possible that children who grow up with depressed parents, they are likely to experience anxiety. A large number of studies have explored the effect of psychological problems on media addiction. Individuals with depression and anxiety are likely to use media to cope with negative feelings, which increases their vulnerability to media addiction. Previous studies have found that adolescents with internet addiction are much more likely to be depressed. They use smartphones addictively to avoid anxiety. Lam found that effect of parental depression on adolescent internet addiction is mediated through adolescent depression and stress. Moreover, Lee found Korean students' negative parenting behaviors indirectly influence their children's internet addiction through depression and anxiety. So we propose the hypothesis that children's depression and anxiety will mediate the relationship between parental depression and children's smartphone addiction. As for our methodology, we got data from Children's Comprehensive Survey collected by the Ministry of Health and Welfare and the Korean Institute for Health and Social Affairs. Data was collected from self-reported questionnaires of second grade to ninth grade students and their parents. Our final sample includes answers from 1,629 children and their parents. We used SPSS software and took a bootstrap procedure and employed Model 4 of the process macro to assess the mediation effect of children's depression and anxiety between the parental depression and children's smartphone addiction. A confidence interval test was conducted to test the validity of the total direct and indirect effects. Let's move to the results and discussion. According to Table 2, we can see significant correlation between parental depression, children's depression and anxiety, and children's smartphone addiction. Specifically, parental depression, children's depression, and anxiety were positively correlated with children's smartphone addiction. As shown in Table 3, in the first step, we entered control variables of children's sex and grade, and also parent sex. In the second step, we entered parental depression. The second step of the regression model showed significant results. The results demonstrate that parental depression was positively related to children's smartphone addiction. The more depressed parents felt, the more addicted children were to smartphones. Therefore, H1 was supported. We can see the Figure 1. The mediation analysis results show that parental depression is positively associated with children's depression, and the children's depression is positively linked with children's smartphone addiction. Children's depression therefore plays a potential mediating role in the link between parental depression and children's smartphone addiction. The results also showed that parental depression is positively linked with children's anxiety, and also children's anxiety is positively associated with children's smartphone addiction. These findings show that the relationship between parental depression and children's smartphone addiction is partially mediated by children's depression and anxiety. Both H2A and H2B were supported. Our research results shows that parental depression can positively predict children's smartphone addiction, consistent with previous findings. A possible explanation for this is that children with depressed parents are likely to experience stress related to interaction with family members and to use smartphones as a means of relieving interactions with their parents. This increases their likelihood of being addicted to their platforms. We found that parental depression positively influences children's depression and anxiety, which in turn positively affects children's smartphone addiction. Because parental depression increases the risk of depression in children and also their emotional self-regulation. Smartphone allows individuals to feel support when use it. Our finding indicates that the problematic media use among children may not only be a problem exclusive to them, but also a problem of the family, and particularly of the parents. Considering these findings, educational and preventive programs should be designed to target parents. For the last part is the limitation and future studies. Our study also includes some limitations. There are some other mediators might play roles in problematic media use, such as parental behaviors and negative parenting style. Future studies should explore other possible mediators to explain our mechanism better. And because of the cross-sectional nature of this study, the causality between variables cannot be confirmed. Future study should examine the validity better, and because this study was performed just on South Korean students and their parents, it is unclear whether the finding can be generalized, and future studies should more consider the cross-cultural applicability. And thank you for listening. That's all of my presentation today. Thank you.